Hey there, Dr. Nicola here. Welcome to part 3 of my Down and Dirty Truths About Chronic Lyme series. Today, we are going to talk about why an infectious disease doctor may be the very worst doctor you can see about chronic Lyme. So it seems intuitive, right? We know that Lyme is caused by a bacteria called Borrelia burgdorferi and all its friends, Bartonella, Babesia, and the other co-infections. These are infections, yes. And when we have infections, we need to go see a doctor. Yes. And so when you need to see a doctor and you have infections, what kind of doctor do you think you'd want to go see? I would say at first response, an infectious disease doctor, right? Doesn't that make sense? And you think that infectious disease doctors are going to be able to identify your problem and give you treatment and make you feel all warm and fuzzy about it, and it's going to be great. Well, I'm here to tell you that the majority of times that is not how it goes down. And I'm sad to say this. I really am. I'm very sad to say this. And disclaimer, I'm not saying that infectious disease docs are not good people. I'm not saying that they can't help anyone. I am making a generalization here, and there are some infectious disease docs that are treating chronic Lyme, and all power to them, and huge kudos and respect to them for doing that. But the rest of them are not. Best case scenario is they would be able to help you and provide you some treatment. That happens occasionally. Next best case scenario is they say, look, okay, I just don't know a lot about this. I'm not the best person for you. But here's what we get the majority of times. I have patients who are ridiculed. I have patients who leave the office in tears, their office, not my office. I have patients who are told that they need a psychiatrist, that they don't have Lyme disease, that chronic Lyme disease does not exist. They get yelled at. It's horrific. So there's a reason for this. It's not that they're bad individuals. I'm sure they're quite wonderful individuals. The reason that this happens is because of the stance of the Infectious Disease Society of America. Okay, I'll call it the IDSA. The IDSA has a very strong stance that says that chronic Lyme doesn't exist, that all Lyme infections are treatable with 14, 21, maximum 28 days of antibiotics. Okay, now that is going to be another topic in this series, so stay tuned for that. But what I want to express today is that Infectious Disease Society of America believes that if Lyme exists, and they do believe in acute Lyme, but it's treatable with like 14 days of doxycycline. Okay, and that's going to eradicate all the bacteria, all the infection. So their view is anything that exists beyond that short course of antibiotics is what they call post-Lyme sequelae, which if you read their treatment guidelines, kind of means it's all in your head. Okay, and I've had many patients told that by infectious disease docs. It's psychosomatic, it's stress, it's anxiety, you're depressed. Okay, so their whole position, and it's given rise to what we call the Lyme wars, right? So their position is there is no such thing as chronic Lyme. Therefore, they're not going to treat chronic Lyme because they don't think it exists. Yeah. So when you walk into their office, I've been sick for 10 years. I've got a positive test for Lyme. Maybe they'll give you 14 days of doxycycline and then they'll be like hands off after that. Or they'll tell you it's something else, or they'll just, kind of like blow the whole thing off. Right? So beyond that 14-day course of doxy, whatever, there's a few in their treatment guidelines, there's a few different antibiotics, but it's never more than 28 days of any one thing. So after that, in their view, it's all just kind of psychosomatic or stress related or due to something else. Right? And this is how they have been taught. They've gone through medical school being taught this. This is like it's institutionalized in them. Right? So the IDSA is not your friend as a person with chronic Lyme. And by default, the trickle-down effect is that the infectious disease doctors are unlikely to be your friend as well. And so I am trying to save people from the horrific experience that may be a visit with an infectious disease doctor who can be, downright rude, hostile, arrogant, and just being like, categorically, you don't have Lyme disease. Even with all these positive test results from good labs, or even a positive test result from LabCorp, or whatever, categorically, you don't have Lyme disease. There's no such thing as chronic Lyme, right? And it's soul shattering for people who are trying to get help, and maybe trying to get help through their insurance system. Imagine that. And so it's just soul destroying. And I've had so many patients, they almost have like medical PTSD from these kinds of experiences. Okay, so recognize that Infectious Disease Society is putting out those standards of care. They're putting out their treatment guidelines, and they're insistent that there is no existence of Lyme outside of that. Right? Then we've got the ILADS group, the International Lyme and Associated Disease Society, who is the group, the society that does believe in chronic Lyme. And so all us, I'm an ILADS member, have been for many, many years. We're all in the crew of, yes, there's chronic Lyme. Of course there is. Like, how can we help people? And they actually have their own treatment guidelines. So the Lyme Wars is kind of this like group of this battle between the IDSA saying there's no chronic Lyme, ILAD saying there is chronic Lyme, and all the poor hundreds of thousands of patients getting lost in the middle, right? Because of politics. So it's really horrific. I wish it wasn't so. This is also the reason that some Lyme docs, like on the ILAD side that treat chronic Lyme, get under a lot of scrutiny because of this dichotomy, and because the Infectious Disease Society of America says these are the treatment guidelines for Lyme, and anyone who's going outside of those standard treatment guidelines, for example, a naturopathic doctor or medical doctor who's Lyme literate prescribing longer term courses of antibiotics, it's a little dodgy, it's not easy. And that's why we've lost some of our top Lyme docs, because they have come under scrutiny, and some have even lost their license, and some have had to fight hard for their license. So that's the environment we're dealing with here. Is it pretty? It is not. It is a real mess. But I think we just have to be realistic about it and be like, okay, this sucks, but this is the situation. And seek out the practitioners. There are plenty of practitioners. I have seen ILADS grow over the course of the last 15 years or so, from, the annual conferences where there's, maybe 100 people, and we're all like the renegade people out there doing the thing. And now there's like thousands of people. It's a huge organization, and there's lots of different kinds of practitioners. And so, they have a referral list. So if there's something for you to get from this, it is, if you are looking for a Lyme literate practitioner, ILADS does have a referral list. Okay. So one, you could come see me. I work with patients around the world virtually. But if you are looking for a Lyme literate practitioner in your area, go to ilads.org, and they will provide you with some practitioners in your area that are members of ILADS. And if they're members of ILADS, they are not going to laugh you out of their office for saying that you have Lyme or you think you have Lyme. Okay. They're the people that you can trust. And so it's a great resource. Not everyone knows about it. Some people are like, again, Googling away Lyme physician wherever they live. But ILADS is a reputable organization, and their members at least know what's going on. Obviously, there's going to be different personalities. There's going to be different skill levels, different experience levels. But just as a whole, you can be pretty much assured that that practitioner is going to believe in chronic Lyme, know how to test you accurately, and know how to treat you, and treat you well as a human being in the meantime, right? So that's all for today. I look forward to seeing you in the next video.